Renal impairment impacts about a quarter of myeloma patients at diagnosis, and this number only increases over time. In fact, it's a hallmark feature of one of the CRAB features for myeloma diagnosis. Unfortunately, a lot of clinical trials with CAR-T excluded patients who had renal impairment, and the KARMA clinical trial, which evaluated Ide-cel, excluded patients with a creatinine clearance of less than 45 milliliters per minute. And this is a substantial proportion of patients. So again, we really need to understand the safety and efficacy of Ide-cel in this population. So we looked at this retrospectively across 11 different centers in the US Myeloma Immunotherapy Consortium, and what we found was very encouraging. There were about 30 patients who had renal impairment, including about 10-11 patients who had severe renal impairment as defined by a creatinine clearance less than 30 mLs per minute or being on dialysis. And the safety of Ide-cel was comparable. There was a signal of some more cytopenias in the very short term at day 30, but by day 90 it was all comparable. CRS, ICANS, non-relapse mortality was identical. And very importantly, efficacy was comparable. Response rates and progression-free survival was very comparable in patients who had renal impairment, including severe renal impairment, compared to patients who had normal renal function. So the take-home is, do not limit access to CAR-T by patients' renal impairment, and all patients should have access to CAR-T and they can all benefit from it.